The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, don't forget to like the video and subscribe to the channel for support. UNisom, a drug from the group of antihistamines. UNisom. It is available in tablet, capsule and liquid forms. The active ingredient of the drug is Doxylamine. What is UNisom? In which disorders is it used? UNisom is an antihistamine that reduces the effects of natural chemical histamine in the body. Histamine can produce symptoms of sneezing, itching, watery eyes, and runny nose. Antihistamines can cause drowsiness and are sometimes used as sleep aids. UNisom is used to treat sneezing, runny nose, watery eyes, hives, skin rash, itching, and other cold or allergy symptoms. UNisom is also used as a short-term treatment for sleep problems. How is UNisom used? If your doctor has prescribed this medication, take it as directed. Do not use in larger or smaller amounts or for longer than recommended. This medicine is usually taken only for a short time until your symptoms clear up. Do not use UNisom to treat insomnia in a child younger than 12 years old. Ask a doctor before using this medicine to treat cold or allergy symptoms in a child younger than 6 years old. Take this medicine with food or milk if it upsets your stomach. To treat insomnia, it is best to take UNisom only when you can devote several hours to sleep. Follow your doctor's instructions. Doxylamine starts to work within 30 minutes, and the effects last up to 6 hours. Call your doctor if your cold or allergy symptoms do not improve after 7 days of treatment, or if your sleep problems do not improve after 2 weeks of treatment. This medication should only be used for short-term treatment. Take the missed dose as soon as you remember. Skip the missed dose if it is almost time for your next scheduled dose. Do not take extra medicine to make up the missed dose. When treating insomnia, if it is almost your normal waking hour, skip the missed dose and wait until you are ready for bed again. Here are some things to know before using UNisom. You should not use UNisom if you are allergic to it. Ask a doctor or pharmacist if it is safe for you to take UNisom if you have other medical conditions, especially glaucoma, an enlarged prostate, problems with urination, or asthma, bronchitis, emphysema, or other chronic lung disease. Drinking alcohol while taking Doxylamine can increase your risk of side effects, especially excessive drowsiness. Try to limit the amount of alcohol you drink while taking this medication. UNisom is not expected to be harmful to an unborn baby. Do not use this medicine without a doctor's advice if you are pregnant. Doxylamine may pass into breast milk and may harm a nursing baby. Antihistamines may also slow breast milk production. Do not use this medicine without a doctor's advice if you are breastfeeding a baby. What are the side effects of UNisom? Common side effects of UNisom may include blurred vision, dry mouth, nose, or throat, constipation, or mild dizziness or drowsiness. Side effects such as dry mouth, constipation, and confusion may be more likely in older adults. If this video was helpful for you, for support, like the video and subscribe to the channel. Share your views and experiences in the comments section. I wish you healthy days.